Hello and welcome. When you see me here, you know it's Matters Health and always your favorite doctor. So today I want us to discuss a very important topic that is danger signs in pregnancy. What are danger signs? These are warning signs and symptoms that basically present in a pregnant woman that will indicate that either the baby or the mother are at risk or they are at imminent risk. Okay, so there are several that have been discussed in different quarters, but today I want us to look at around 8 danger signs that you need to be aware about, especially if you're carrying a baby in your womb. So number one is severe vaginal bleeding, or basically vaginal bleeding. So vaginal bleeding can be a sign that you are probably having a miscarriage. It can also be a sign that you are having a urinary tract infection. So we looked at urinary tract infection in pregnancy. You can refer to one of our videos. And then, of course, with bleeding, basically depending on the severity of the bleeding, you patients can also present with paleness. Okay, so pallor is a sign of reduced amount of blood in your system. So, and then dizziness, and then hypotension. So basically feeling dizzy, hypotension, and all that. The second thing that you need to be aware about is severe abdominal pain. So, as the pregnancy grows, you will feel some discomfort and probably a little bit discomfort around the lower abdomen. They are called what we call pressure symptoms, especially when the baby is now moving down, ready for delivery, probably from around 36 weeks thereabout all the way to 40 weeks. So that one sometimes it's normal, but this time when you experience severe abdominal pain, okay, severe abdominal pain, that one is a danger sign that you need to be able to go to the hospital as soon as possible for you to be able to get checked and be able to know exactly what is happening. Now, what can cause severe abdominal pain? We have said that number one, it could be the pressure symptoms, the normal pressure symptoms. Number two, it could be a sign of a urinary tract infection. We discussed UTI in our previous video, so you can always refer. And then abdominal pain, especially in early pregnancies. Okay, early pregnancies are probably the first trimester pregnancy. Okay, can be a sign that you might be having an ectopic pregnancy. So if you are expecting your menses this month, but then you didn't get them, and then next month you realize that you've started, all of a sudden there is a sharp abdominal pain either on the right or on the left side of your tummy. Okay, that one might be a sign that you might be having an ectopic pregnancy, and therefore you need to be able to be rushed. You need to rush to the hospital so that you're able to have a look at and be able to know exactly what is causing this abdominal pain. Now, severe abdominal pain, especially during the labor, okay? Severe abdominal pain during labor that is very sharp, non-radiating, and non-relieved, okay, can be a sign of probably uterine rupture. But that one we will discuss it in details in a separate video, okay? And then the other thing that you need to be aware about during pregnancy, the third danger sign is persistent headache. Okay, persistent severe headache. So headache during pregnancy can mean a lot of things, but today we are going to discuss two major things that can cause headache. Number one is signs that you might be having high blood pressure in pregnancy, what we call preeclampsia. So with high blood pressure, basically patients will present with severe headache that is non-relieved by pain medication. The other thing is the second thing that can also cause severe headache in pregnancy is anemia. So anemia is when you have low hemoglobin level. So basically your red blood cells capacity to carry oxygen is reduced. So what does that mean? It means then your brain will receive little oxygen and therefore it will be kind of hypoxic, and that can cause headache. Okay, now with anemia, it comes with dizziness, okay, and blurring of vision. The same with high blood pressure during pregnancy, what we call preeclampsia. And the other thing that can come with preeclampsia is eclampsia, which basically can present with the fourth danger sign, that is convulsions or fits. So basically, anytime you have convulsions or fits in pregnancy, that is a sign that you are having severely uncontrolled high blood pressure, what we call eclampsia. Now, eclampsia in itself, okay, is a danger both to the baby and to the mother. Okay, so basically the baby and the mother are at risk. With eclampsia, basically you will end up having reduced blood supply to the placenta, and with reduced blood supply to the placenta, it means the baby will basically go into distress, and that one can actually lead to both the death of the baby, but also the mother is at risk, and it actually can lead to death of the mother. So anytime you're having severe headache, okay, blurring of vision, do not wait until you get to preeclampsia before you go to the hospital. Do not wait until you get to eclampsia, which presents with fits, loss of consciousness and all that. So severe headache, please rush to the hospital, get checked, okay, so that we are able to know whether it's just anemia or we need to be given blood or anything. Okay, the other danger sign that I would want us to look at, the fifth danger sign, is high temperatures of above 38 degrees centigrade, or what we call fevers. So it can also present with either fevers and chills, whereby mtu anasikia baridi and then you tetemeka and all that. Okay, now high temperatures are a sign that you might be having an infection. Okay, and the worst infection here that we really don't want you to have is chorioamnionitis. Chorioamnionitis is infection of the membranes that are covering that baby. Okay, once you have chorioamnionitis, the only thing that we need to do is to just deliver. Okay, so but of course antibiotics are needed at that point. But high temperatures, okay, it's a sign that you might be having an infection and therefore you need to be seen at the hospital. The second infection that we don't want to have is an upper urinary tract infection, mostly pyelonephritis. But of course it will also present with nausea and vomiting, high temperatures, general body weakness and all that. Okay, so and then the other thing is, of course, with lower urinary tract infection as well, cystitis, urethritis, and all that. And then the other infection that you don't want to have is malaria. Okay, in pregnancy, it can cause high temperature. So basically, when you have high temperatures in pregnancy, please just go to the hospital so that you're able to, we are able to ascertain exactly what causes these high temperatures in pregnancy. The other thing is loss of consciousness. Of course, we have talked about convulsions. Okay, so those are the fits. Okay, convulsions. But here is loss of consciousness. Okay, or fainting attacks. Now, fainting attacks can be caused by either when your blood level is very low, so anemia can cause the fainting attacks. Number two is when you have little or low sugar level, so you can get hypoglycemia in pregnancy. And then the other thing that can cause that is hypotension. Okay, so you can actually bleed a lot and then basically end up with dizziness. Okay, so hypotension, anemia, severe, and then hypoglycemia. Okay, and of course eclampsia as well can actually cause as well some dizziness and some fainting attacks. And then the seventh danger sign that I want us to discuss today is reduced or absent fetal movements. Okay, so when the baby has been playing normally and then all of a sudden you realize that the frequency at which the baby is playing in the stomach or in the womb has reduced. Okay, so what can cause that? Number one is when the baby is under stress, what we call fetal distress, can lead to reduced fetal movements. Okay, but also if the baby has been under distress for quite some time and you have not identified it in time, okay, the baby's heartbeat might stop. Okay, so you end up with fetal demise. So when you have fetal demise, you will have absent fetal movements. Okay, so anytime you feel like the baby has not been playing normally, okay, you need to rush to the hospital. There's an ultrasound that we normally do, and there are parameters that we basically check, called the Bishop score. Okay, no, there are some parameters that we normally check that basically will help to know exactly whether the baby is okay or the baby is not okay. So you need to be able to go to it's called the BPP. Okay, yes, I'm sorry for that. It's called the BPP. So we basically check that and grade, okay, on the how the fetal well-being. So biophysical profile. Okay, so grading how the fetal well-being is. So you need to go to the hospital as fast as possible. And then number 8, one of the danger signs that you also need to check is drainage of liquor, okay, before the baby is term, okay, or drainage, maji ya mtoto kutoka nje before the baby is term, okay, and that one can be a sign of a urinary tract infection, but most of the time it can be a sign that you might be having what we call chorioamnionitis, where it's infection of the membranes. And then, but I will do a separate video on what to call premature rupture of membranes. So the membranes have ruptured prematurely. So I will do a separate video specifically on premature rupture of membranes, what you need to watch, what are the causes of premature rupture of membranes, and how do we manage premature rupture of membranes. The other thing that I will also want to discuss probably in a separate video is what to call the first trimester. So we will now break down, next video will be breaking down on the first trimester danger signs, the second trimester danger signs, the third trimester danger signs, and then postpartum or post-delivery danger signs that you need to be able to be aware of during pregnancy. And as always, if you're new here, please consider subscribing, consider commenting, and if there is a topic that you will want me to be able to handle, please go ahead and write it in the comment section. I will take time to be able to look into it, and then I'll be able to handle it. Okay, so you can follow us on our Facebook page, that is Zawadi Premier Hospital Ngong, and then in our Instagram as well, Zawadi Premier Hospital _ Ngong, and then on our YouTube channel, Doctor on Wheels. Okay, so if in case you experience any of these signs, please don't hesitate to come to Zawadi Premier Hospital. We'll take good care of you. We'll be able to examine you and be able to ensure that your health is well taken care of, both for you as a mother, but also for your bundle of joy, your baby in your womb. Okay, until next time, God bless you.